Aster CMI Hospital. I'm Dr. Ravish Keni, Senior Consultant Neurologist and Head of Epilepsy Services in Aster Hospitals, Bangalore.
Hi, I'm Dr. Ravi Gopal Varma, Director of Global Center of Excellence in Neurosciences, Aster Hospitals, Bangalore.
Today, 17th November, is recognized in India as National Epilepsy Day. So, the main purpose of this day is to create awareness regarding epilepsy. So, with this perspective, we are here to discuss a few salient points regarding epilepsy and its management and regarding the stigma, myths, etc. So, first coming to what is a seizure, what is epilepsy? So, seizure or epilepsy is a neurological disease where the patient experiences symptoms which happen suddenly, which can be diverse. So, what exactly happens is that in the brain there is a short circuitry happens where the nerves abnormal discharge electrical impulses which causes the person to have various symptoms which can vary from jerking of the body, stiffening of the body, frothing from the mouth. Patient can behave abnormally. Patient can have one limb jerking. Sometimes they can have other abnormal behavior, or some patient can have simple symptoms like they get fear of blank for a few seconds. So these are various symptoms which the patient can encounter. So when patient has one episode of seizure, we do not label epilepsy. But when there are two or more episodes of seizures happening without any reason, that is unprovoked seizures, we label the patient to have epilepsy. So broadly speaking, epilepsy is of two types. It can be a focal epilepsy where the discharges in the brain originate in one particular area of the brain, or it can be generalized where they start in both of the brain together. So depending on type of epilepsy, the patient's symptoms vary. So there are a lot of myths regarding epilepsy. Commonly people think that epilepsy is a psychiatric illness and that people commonly visit psychiatrists, and some people believe it's supernatural occurrence and they even sometimes engage in even surgery. So there are a lot of stigma which people with epilepsy encounter in daily lives, right from the job perspective to education, marriage, and even conception. There are various issues which they feel. So this day basically is the importance of that to help the people with epilepsy live a normal life by creating awareness among the public that this is a simple neurological disease which can be easily managed with medicines, and in some patients when medicines fail to control seizures, there are other options like surgery possible for controlling this epilepsy. So there are basic investigations by which we confirm epilepsy. First thing is basically a brain scan, which is MRI. We need a proper 3 Tesla MRI, which is the high definition MRI, for finding out exactly in the brain if there is a problem which is responsible for seizures. And second thing is we do EEG, which is like a brain graph, which helps to pinpoint regarding where in the brain seizures are originating from. So by doing these two investigations, we can confirm regarding epilepsy and what type of epilepsy it is, based on which we try medicines. So with medicines that are available, they are safe to take, and seizures can be very well controlled in majority of the patients. But despite this, there is a certain bracket of patients, roughly about 20-30% of which medicines fail to control seizures. In these patients, rather than indulging in alternate therapies like homeopathy, Ayurveda, or even supernatural therapies, it is always better to come to a center which is specialized in epilepsy, where we can comprehensively evaluate regarding whether the patient can benefit from surgery for epilepsy. So for this, we have to investigate patients by doing some certain tests, basically comprising of video EEG, and some people we have to do a nuclear imaging scan like PET scan. By doing all these tests, we basically discuss in a surgical meeting, and then in some patients, definitely brain surgery can help them in getting rid of seizures. So, sir will be discussing regarding what are surgical options possible for epilepsy.
So, as Dr. Ravi said, there are most seizures can be treated medically. There are some seizures which are medically refractory, that is when medicines do not work, or more than 3 or 4 medications are not giving in the benefit that we expect, or the patient has other side effects due to medications, irrespective of the fact that the seizure is controlled. So that is when we think of surgery. And the good thing is a good percentage of them can be treated surgically in two perspectives. One is surgery can be curative in certain situations where the focus of epilepsy, which is there in the brain, if we are able to remove it, then the source of these electrical mismatch does not occur and seizures don't occur. There is another good number of patients who are refractory and who We may not be able to cure from epilepsy, but there are patients who have got 15, 20, 30, 40 seizures a day, which we can do certain procedures and reduce it to 1 or 2 a day. And in result, the patient's scholastic performance, the social performance, and all that improve because the number of seizures are reduced. These are called palliative procedures, and a lot of high-end technology has been used in palliative surgery, like vagal nerve stimulation. We put an implant into the vagus nerve, which will stimulate and stop the seizures from progressing. Similarly, we do deep brain stimulation for refractory seizures, and therefore it's very important to classify what type of seizure it is, and then whether these treatment modalities are beneficial or not. Once we plan that out and get a detailed evaluation, which the neurologist does, we take the chance of getting surgery done, and we have seen very good outcome with surgery in certain patients, and they have been cured of epilepsy.
So the important thing here is that people with epilepsy should not hide and stay in their homes. There are various treatments possible for them, be it medical, be it surgical, which can enable them to get a normal life, and they can succeed in life like as everyone does, and they should not discriminate merely because they have epilepsy.
We have many greats in the world who are epileptic people. Like John T. Rhodes is one of the world's most magnificent fielder in cricket. He was a person who had seizures and was controlled with medication and other things. So like that, seizures is not something that we need to hide and put it in the closet and lock it. It is something that we can analyze, we can treat, and it is no harm, or it's not a bad omen. It's nothing like that, like what people think. It's just an ordinary disease like diabetes, like hypertension, which can be controlled, which can be treated, and which can be in certain cases cured.
So as discussed, epilepsy can be easily treated, and certain cases can be completely cured as well. So it is imperative that the patients visit the right place where these modalities of treatment can be given, and they can be appropriately treated.
So for this, we have a Center of Excellence in Aster Group of Hospitals in Bangalore, where Dr. Ravish and myself will be involved in analyzing patients, in treating patients, and this is going to be a Center of Excellence for epilepsy. And we would suggest that everyone who has epilepsy, if they know somebody of a person who's suffering from epilepsy, please do not hesitate. Visit the doctor, visit a center like ours, so that we will be able to guide you in the right way, take you to a situation where probably it can be completely cured.